here at Ask the Gynecologist. We are broadcasting simultaneously on Facebook, recording for YouTube publication, and also we are live on Instagram. Tonight, I'll be talking about babies, September babies, making babies. I know I've not been able to come up live since we had the September seminar a few days ago. But first of all, I want to say, and I want to use this opportunity to welcome you all to the month of September. So the month of September always heralds in the, I would say, the last 4 months of the year, September, October, November, December, before the Christmas period. So as we started this September period, I pray by the grace of God Almighty, September will bring us blessings, favor, grace in all we do. And also those that are still waiting and searching for the fruit of the womb, this year will not pass you by. And I have that faith that by the grace of God, if we keep together in faith, we talk together, admonish each other, and we do the right things, by the grace of God, pregnancy, your desire shall be fulfilled. If you're watching me on Instagram, I want to say good evening to you all. And thank you so much for being here. Strictly Yami, Chi for Life 2005, Nana Yusuma, Kids.ng, Buchianta, Favor, Makowankwo. Over here on Facebook, Christina, Oladumoye Dowu, Abi Habi, Franka Okoye, and Becky Johnston, Franka Okoye, and everybody watching on Instagram, on Facebook now. I really appreciate you. God bless you, and thank you so much for being here. Once again, as always, I'm your one and only Dr. J at Ask the Gynecologist, and it's my so much pleasure to be here and to talk about these things today. So if you're watching this for the first time, I want to say good evening. My name is Dr. J, and I want to say welcome once again to Ask the Gynecologist. Over the last 12 months, ATG has gone through so many challenging things, times, and strides as well. And over the last 12 months, we've been able to do things that were not, even if possible, in the last 5 years when ATG started. God has, you see, for gold to shine, gold has to pass through fire. For a baby to walk, sometimes they learn to fall down. Sometimes failing is part of growth. Sometimes failing is part of excellence. There's no general that has really that does deserve to call a general that has not been to battle before. If you say you're a general, you don't have battle scars, you're joking. Every general has got battle scars, and we wear them with pride, with pleasure, but we don't dwell on those past things. We use it as a platform to launch ourselves, springboard ourselves into better opportunities. And that is what ATG has done in the last 12 months, despite our challenges. Those people close to ATG, close to me, will know that it has been a difficult time over the last 12 months since July last year. But God has been faithful. And as God has done it for ATG, God will do it for you too in your situation. Tonight is going to be an open clinic session. So if you have any questions, like I did about 2 or 3 days ago, I'll take the questions as well, and we trash them, we mash them, we get answers to them. Linda Njoku, welcome. I can see your beautiful face and your lovely yellow dress on your profile. Meye Susan Ifeoman Johnston, Sonia Adaize Osai, Sijuade Adeoba. On Instagram, we have CBabe26, Liz Queen. CBabe26, thank you so much. And thank you, Liz Queen, for being here. God bless you. It's a pleasure to have you guys. Whenever I see faces like this up all the time, it gives me that joy that we are still able to impact lives. And we'll keep on doing so as much as we can, as far as our breath is still able to put a fog on the mirror, as far as we are still breathing. So thank you all guys for being here today. It's my pleasure to introduce myself once again, Dr. J. And I'll open the floor now. Let's take questions. Let's answer them. Let's trash them tonight, this afternoon, this evening, okay? By the grace of God. So thank you once again for being here. I appreciate you. And it's my pleasure to do this today. So ATG IVF Center is open. In fact, from this Monday just passed 2 days ago, we've opened our floor to take in the September batch. So if you want to get your IVF done, you've been diagnosed with frozen pelvis, your cervix is blocked, you have scar tissue in your womb, You can get your hysteroscopy done. You can get your IVF done at ATG IVF Center. We are running a special promo service, and the cost of IVF now is steady. Only the fact that you just need to pay for your drugs and get all these things fixed. So if you want to get the full price for the IVF center, for your IVF, call the office tomorrow morning. They open 9 o'clock. Call them tomorrow, call them 8 o'clock, call them 9 o'clock. They will put you through and tell you the cost of the IVF without delay. So Faith Chika and Maseri 92 Lakes Queen, thank you so much. So once again, I want to say welcome to the month of September. By the grace of God, the things that make people fall in September will not be our own portion. By the grace of God, the things that make people fail in September shall not be our portion. The things that make people not be able to carry their vision forth, their vision into fruition, shall not be our portion this September. By the grace of God, and by the grace of God, through faith, we shall break through this month, and September shall bring His mercies. You shall do that test this month, and you shall see those 2 lines. Whatever it will take, whatever it will make or to take, by the grace of God, this month you do your test and success shall be yours. You see those 2 lines by the grace of God. There's a question here from Becky Johnson. She's saying that can bilateral polycystic ovarian ovaries cause infertility? Very unlikely. But if your polycystic ovaries is causing what we call the syndrome, polycystic ovarian syndrome, okay, because it's making you not to ovulate, it can cause infertility. But just simply the fact that you have bilateral ovaries, bilateral polycystic ovaries, that does not cause infertility. But if you have bilateral ovarian syndrome, it can cause infertility. Bilateral polycystic ovaries is different from polycystic ovarian syndrome. Polycystic ovarian syndrome is different from bilateral polycystic ovaries. Polycystic ovaries is just to describe something. Because you are tall does not mean you always hit your head, okay, when you passing through the door frame. But if you don't watch well, you hit your head. So you got bilateral polycystic ovaries, means you're tall, but that will not cause infertility if you don't have irregular period or scanty period or biochemical problems with that, okay? So question now, someone is asking a question, someone says my volume is low, so let's increase the volume here because I'm shouting here in my office. So it was a question that I saw, but it's gone off. Glory in this eye asks, my period has been late since July. You saw your first blood test was positive. You had abdominal pain. You had scan, no pregnancy seen. Another blood test done is negative. So it's probably that you had a miscarriage. It's probably that you had a miscarriage. Okay, it's possible that you had a miscarriage. And Glory Onyechi, I saw a question from somebody. I can't see it again. Okay, let's keep the ball rolling. Okay, please guys, follow. Christina is giving an instruction. Keep your questions simple and keep them straightforward. It will help me to answer them quickly so I can move to other people's questions as well. Keep your questions simple. Keep them straightforward as well. Keep your questions simple. Keep them straightforward. The number to call for IVF is already on the screen already. The number to call for IVF is already on the screen. So you can call, and the times to call them, don't call them tonight, they are closed. The number is there and the time to call them is there as well, okay? The number to call is there and the time to call the number is also on the screen as well. Okay, Okolo is asking, what causes missed miscarriage? In the first instance, if anybody says they know what causes missed miscarriage, is a lie. Okay, but there are many things that could increase the risk of missed miscarriage. Number one, if you have chromosomal problems, maybe which is not your fault. It doesn't mean that you have the problem. It's just that when the genes of daddy and mommy are mixing together to form a new baby, they can misalign and they can lead to miscarriage. Sometimes infection, sometimes failure of implantation. The eggs does not implant. Sometimes you have poorly controlled diabetes and it can cause miscarriage. Sometimes you have abnormalities with your thyroid gland that is not well managed. It can cause miscarriage. Sometimes too, you have kidney problems. You had malaria. They can cause miscarriage. Aloha and Kate, the number is already been published already. Can somebody help me message Aloha and Kate and give her the number for the IVF office? Okay, they open tomorrow morning. What causes low abdominal pains 3 weeks after period? is probably endometriosis, okay? And you cannot see endometriosis on scan. They are too small to see on scan. You will need laparoscopy to diagnose endometriosis. If you can see endometriosis on scan, that means that endometriosis must be so bad. Thank you, Christina. Kawuna Bature, happy new month to you, to Bature from the northern part of Nigeria. Happy new month to you as well. We are here on Instagram and Past Peculiar Foods. Thank you so much. Omotola Ife Akinduyo. Thank you so much and good evening to you too, Omotola. Shola Bomsol, welcome once again. I can see you on Instagram. So I'm here. Can I take vitamin E and omega-3 fatty acids while waiting to get pregnant? You can. It's safe. It's okay. What causes back pain in pregnancy? Usually ligament stretch. But if the back pain is not settling down with painkillers, it could be onset of labor or premature labor. Get examined. Okay? Or pain in your back in pregnancy, usually called by ligament pain. If you've been doing shopping up and about all day, there'll be stretch of the ligaments around your womb. Your womb has 4 ligament support, 2 to your groin, left and right, and 2 to your backbone. The more you stand, the more you walk up and down, you cause stretch. I'm not saying you should not walk, but life is balance, okay? So there's a question here by Oranos Stella. She's saying that when is the time to go for HGC? How many months after trying? So if you're trying to get pregnant, you're not able to get pregnant, you've done your husband's sperm count is good, you've done your hormonal profile, which is good, get your HSG done as soon as possible, okay? Today, as soon as possible. The best fertility booster for men. Okay, I don't know what you mean, I don't know. If you're saying that, oh, the sperm count is low, you want to boost the sperm count, there are vitamins for that. But if there's no sperm count at all, then you have to consider doing scrotal scans and then knowing why the sperm count is low in the first instance. The question here by Faith Chika 296: how do I prepare my body for pregnancy? Your body is already ready for pregnancy the day you are born. There is no need to do. There's nothing else to do for your body. But if you're not able to get pregnant, then we need to do investigations to know why you can't get pregnant. But there's nothing for you to do to prepare your body. Your body is already ready for pregnancy from the day you were born, honestly speaking. Doctor, what causes endometriosis? We don't know. Nobody knows, honestly speaking. But what we know is that endometriosis is when the tissues that normally line the womb cavity, when they move outside and they implant outside the womb, they can get stuck to the ovary, to the tube, even to the bowels, and they get the everything stuck together in your tummy, and it makes your ovaries not be able to release egg to get into the tubes. Peculiar Food is asking, can someone planning to get pregnant take Clomid? No. What vitamins, drugs is advisable to take while waiting to get pregnant? Pregnant care is very good. Pregnancy test on strip says positive for 6 days, but not negative on blood test. That means that test was negative from first instance. Because even if you miscarried, okay, the test of pregnancy will be positive for the next 2 to 3 weeks. So if the test was negative, change all of a sudden within 6 days. That means it was never positive in the first instance. How can one take Duvastone to induce period? Duvastone is not designed to induce period, so you can't take Duvastone to induce period. What vitamin drug can you take while waiting pregnant care? How many months did a woman will carry pregnancy for 9 months now? Everybody knows that. A woman will carry pregnancy for 9 months. It can be shorter if that person goes into premature labor or if the woman has complications of pregnancy. Onyechi is asking a question that she had a miscarriage 3 weeks ago. She was given drugs to flush it out. She had heavy bleeding in the first week. She had spotting in the second week. And on the third week, she noticed she had light bleeding. How do I know that my monthly period is not so and so? What you should do is that get a scan to ensure that there's nothing from that pregnancy that was left behind. Once the pregnancy is totally removed, okay, your bleeding will settle down, okay? And then usually there'll be no bleeding for a week or 2 or 3. Then there might be heavy period. That will be your first fresh bleeding after the miscarriage. Usually, the first period you have after a miscarriage or after a pregnancy or C-section will slightly be heavier than usual. Okay. How can you get rid of endometriosis? You can get rid of endometriosis by, first of all, leaving it alone, by giving medication like contraceptives to reduce the pain or even painkillers, or going through surgery to remove the endometriosis by surgery. Mochibolaton 14, you're not too late. You're welcome. Mochibolaton 14, welcome to Instagram. You're not too late at all. You're always early. You're always on time, my sister. Welcome. Thank you, Christina, for answering Omoto Life. Is it okay to take evening primos while trying to get pregnant? It's okay. It's okay. Can someone with fibroid get pregnant? Of course. It depends on the size of fibroid and where the fibroid is. Okay. There's a question here that I doctor, something. I can't see the question. Doctor, can pregnant care be taken throughout pregnancy? You can if you want, but it will only do its work for the first 4 weeks of pregnancy. Okay. Good evening, Tosin Okusonya. Welcome, Tosin. Welcome, Tosin Okusonya. Welcome. On Instagram, no question. Okay. How many weeks does a woman carry pregnancy? 40 weeks. 40 weeks. A woman carries pregnancy for 40 weeks. And that's approximately 9 months. Okay. Is it risky to get pregnant when a person knows vividly that she has fibroid? You can. Pregnancy, fibroid. Fibroid doesn't mean you can't get pregnant. Let's get it right. Fibroid does not mean you can't get pregnant. It depends on where the fibroid is and how big the fibroid is. If the fibroid is within your womb cavity, it might cause miscarriage. It might make it difficult to get pregnant. Sometimes fibroid can be within the wall or outside the wall of the womb in your tummy. Those ones usually don't cause miscarriage or cause infertility. Can one menstruate and not ovulate? Yes. Perfectly correct. You can menstruate and not ovulate. Ovulation is not automatically menstruation. But if you're having regular cycle, you are most likely to ovulate almost 90% of the time. Sheila Phillips, welcome, Phillips. You add ovulation that is watery, has a slimmage, that has a ovulation, whether it's watery or not, has nothing to do with getting pregnant, okay? And I want to tell you something, if you're watching me today, Smith, Ifeoluwa, thank you so much. Everybody's doing good. If you're watching me today, okay, and you're trying to get pregnant, if anybody is telling you to look for all this nonsense called slippery discharge, where some slimy discharge, is total nonsense. Take it from me, it's nonsense. There's nothing wrong with seeing it, okay? But seeing all those things, egg discharge, does not mean that you are ovulating. And it does not mean you cannot get pregnant if you don't see it. Okay? If you want to know whether you're ovulating, then do the 21 progesterone test. We need to see that. What causes hot flushes? Upper tummy. You're having pain in your upper abdomen. It can be your liver, it can be your spleen, it can be your stomach from reflux. Get scanned as soon as possible. You're diagnosed with adenomyosis, uterine fibroid, enlarged uterus. Can it be operated? We can remove uterine fibroid. Okay? Adenomyosis makes your womb a bit bigger and boggy. We can't remove adenomyosis because it's everywhere in your womb wall. Okay? That means we have to remove your womb entirely to treat adenomyosis. We can remove fibroid because it's focal. It's just on one point. Scattered. But adenomyosis is not what you can remove like that. And it doesn't cause infertility in most cases. So leave adenomyosis alone. Okay? It can make your period a bit painful, but leave it alone. What is the name of fibroid outside the womb? It's called subserous fibroid. Okay? Your period ceased for over 3 months. Have you done your FSH hormone? Go and do your FSH hormone now and send me the reports. Should I add folic acid and calcium to my pregnant care plus? Your pregnant care already has folic acid. But if you're not sure and you want to add folic acid to it, that's fine. That's okay. You just spend some more cash. That's fine. Can a TTC mom on keto diet? No. If you're trying to get pregnant, please leave that keto diet business alone. You're trying to get pregnant, leave keto diet alone. Okay? You're trying to get pregnant, leave keto diet alone. Chinyere Egwatu, welcome my sister. Okay? Welcome. Let's talk. Kedu? How's everybody in the house? Good evening once again. Dr. J here live. My network is not clear. It's okay now, I guess. Can everybody hear me? If you can hear me, please say hello, doc. If you can hear me, say hello, doc. To boost husband sperm, use Adizwa, okay? And also use pre-seed lubricant anytime you're having sex. What is cough syrup for a pregnant woman? You can use cough linctors. If you're pregnant, you're having cough. A woman start a period. Can I use gynaecology to induce period? No. Thank you, guys. Boyo. Thank you so much, my sister. To thank you. Blessing Diebere. Thank you. Charity Douglas, thank you so much. Christina, thank you, Jerry. God bless you. If Stella Kingsley, Simbia Alalade, Francisca Aguche. Okay. Question. Yeah, you can have COVID vaccine. Yes, it's okay. In fact, I've had my COVID vaccine, all the 2 injections. So get it, okay? And let's keep the world moving. Can someone with ovarian cyst get pregnant? Yes. But if the cyst has damaged your tubes, maybe no. It depends. So the answer is yes. But it depends on if the cyst has already damaged your tubes. If the cyst has damaged your tubes, you can't get pregnant with cysts. What causes smell during sex or after sex? If you're having sex with condom, you might smell the rubber. If you're having sex and you're using condom now, you're going to smell rubber. If you have infection and you're having sex, it's going to be smell offensive. So if you're having bad smell during sex, it's probably got an infection. What can you do to boost your follicles? You should be ovulating. If you're not ovulating, your follicles is not as supposed to be. Get your hormone profile done. Any human being, any human lady, any lady that is perfectly okay should have proper follicles around the ovulation. If it's not there, there's something wrong with your hormones. Just get it checked. Stop doing these babalawo things that you are doing. All this, I want to go and take something under the bush. Something. Just get properly checked out. Let's know what's making you not to ovulate. It could be your prolactin. It could be the fact that your eggs are exhausted. It could be that your FSH is so bad. Let's know exactly what's causing the problem so we don't give you wrong treatment. Once you know the question and understand the question, answer will be clearer. You can take your COVID vaccine, please. You can take your COVID vaccine. How can you improve air quality? Try DHEA. But DHEA does not increase air quantity. It only increases. DHEA is antioxidant. It helps to reduce the availability of free radicals, which can damage ovary, which can reduce ovary's lifespan. You can also get Fertility female. Fertility for female, a bit expensive though. You can get it. How do you fix an infection? If you have an infection, the first thing to do is what is causing your infection. It's not magic. We have to take vaginal swabs. Once we take vaginal swabs, we will know exactly what is causing your infection, and then we can treat exactly what is causing your infection and get you properly fixed. Hello, doctor. You want to get pregnant, you are asking about COVID vaccine, you can take it. And in fact, we've been told now that COVID vaccine is even safe in pregnancy as well. What test should you do to know whether you're ovulating? Day 21 progesterone or your progesterone test. It's a type of blood test. Doctor, you've been having waist pain for more than 8 months now. What can you use to cure it? Now you're having waist pain. What is causing your waist pain? It could be your womb, endometriosis, fibroid, polyps, ovarian cyst. Have you done a scan at all? A simple pelvic scan to know whether you have any of or either of these things I've mentioned. Have you checked your appendix? Have you seen a surgeon? Do all these things first. There are so many organs in your tummy. For me to just come out and say that do this and you not have pelvic pain, that means I'm a babalawo, and I'm not a babalawo. I'm a doctor, gynae. I look at things properly. I'm a scientist too. Observe and then prevent or do. Chances of successful IVF with 5 follicles is probably very, 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 very low. You haven't smelly feet in pregnancy, wash your feet and go for some manicure or pedicure, okay? And get your feet scrubbed and exfoliated, right? Okay. Welcome once again. Today we're having a wonderful time. Open class, September babies. We're getting ready for the babies this month. And this month is going to be a wonderful one. That I have no doubt or iota of doubt at all about. Official Christina, welcome. Hair Glamoury, Miss Stephanie. Doctor, where can you get pre-seed lubricant? It's available in most reputable pharmacies, in the offices or shops in Nigeria. Or you can even get it on Amazon or on Jumia. You can get pre-seed there. Doctor, you are on a 28-day cycle. Your period starts on August 31st. When are you going to ovulate? I will not answer ovulation question again. I've done it over and over and over and over and over and over. Just watch our ovulation videos, okay? But for the first sake of today, I'll answer your question. If you have a 28-day cycle, okay, and your period started on 31st of August, your ovulation is probably going to be around September 13 or September 14. But don't focus on ovulation day to have sex alone. I would suggest you have sex every other day. And the only time you're free from sex should be during your periods, if you want. You can have sex even in your period time if you want. That's okay. But for the sake of getting pregnant, the only time you're free from sex is during your period. Every other day is regular sex, okay? Don't wait for ovulation. Okay? Vicky Nabest, what is your question? You need a branch of Abuja. We don't have a branch in Abuja. However, if you want me to refer you to a doctor in Abuja, let me know. Join our services for consult service. I'll refer you to somebody there. But if you're in Lagos or Paraveto, you're going to be in Lagos soon, we have an ATG office in Lagos, and we can look after you there. Okay? And we have one in Lagos for now. We're going to open another one in Surulere soon. We are working on that. Baby Thompson, the number to call is already on the screen. Okay? Doctor, check your inbox. I don't check my inbox. I check our ATG email. I don't check messenger inbox again. It's headache. Okay? There's a question here about swelling feet. You see, swelling feet is common in pregnancy. Most people that are pregnant will have their feet swollen or ankles swollen to an extent, especially with our weather very, very, very hot and warm. But if you're having swollen feet and you have protein in your urine, or in conjunction with that, you have high blood pressure, it's what we call preeclampsia, and that should be handled quickly and straightforward as an emergency by any gynecology doctor or by any doctor that comes across or you come across. Okay, so swollen feet is nothing big deal. But if you got swollen feet, you got protein in your urine with conjunction with blood pressure that is raised, that could be a very bad thing in pregnancy. Okay, questions, slow down. I can't answer everything. Slow down. I'm a human being. I need to read, understand, and give answer appropriately. So guys, slow down. Chioma Nwankwo Nwadiko. Abuja address. Please follow the recommendation by one of our moderators. They will tell you how to get this referral for Abuja. They will send it to you now. Okay. Bubu Rose. Can someone that has multiple myoma, that is, multiple myoma is multiple fibroid, measuring 8 by 6 centimeter in the anterior part of the anterior fundus, and 3 by 3 centimeter in the blah blah blah, you can get pregnant. But the fibroid you have is quite big. I'll suggest you take it out first, okay? But you can still get pregnant, okay? You can take it, but it's quite big, okay? I've seen people that with, in fact, I saw a lady 2 weeks ago, 9 centimeter fibroid here in UK, a lovely, British lady, massive fibroid, 9 centimeter. She is pregnant now. Okay. Well, doctor, what is the best supplement for progesterone? If you have low progesterone, there are things we can do. Okay, we give some progesterone supplements, okay, to boost your progesterone. It works for some people, but not for everyone. For more information on that, because I don't want to start giving doses online, it's a bit dangerous, please send an email to our ATG services or go through our premium services, and one of our team members will attend to you there as soon as possible, okay? Ujunwa Ezi Ogbonna, thank you so much. And welcome once again to Ask the Gynaecologist. I really appreciate you. God bless you. What causes fallopian tube to be swollen? Swallowing. I don't understand what that means. Swallowing. Fallopian tube cannot swallow anything. How effective is catheter used to ripen the cervix? Very effective. They use it if you had previous C-section before and you want to get your cervix ripened, catheter is used and is very safe. What causes pregnancy without symptoms? Pre-seed lubricant boost sperm count? No. Pre-seed lubricant does not boost sperm count. No. Pre-seed lubricants only make the vagina conducive and friendly to the sperm. You're bleeding during intercourse, you probably had an infection, or probably the sex is too rigorous, or probably you're dry during the sex, or probably you're using some toys there. Does fibroid found in the endometrial plate inside or outside the womb? I don't understand your question. Fibroid can be found inside your womb, in your womb wall, or outside the womb. Any other thing you're talking about, I don't understand. How long will treatment for hormonal imbalance last? It depends on which hormone is in balance. There are many hormones in the body. We need to know which hormone is in balance and then we fix it. Okay? It depends on how imbalance is the hormone and how also you behave yourself while you're under treatment. 11 centimeter fibroid, can one get pregnant? Yes, but please remove it before getting pregnant. Your prolactin is 54. Wow. Your prolactin is 54. Your period ceased 3 months ago. What do? Your prolactin is too high. We need to bring it down. Okay? Because it's so high, it will make you not to have period. Because it's too high. High prolactin usually equals to no period. No period in most cases equals to no ovulation. From no ovulation, no pregnancy. For you to get pregnant naturally, yourself, you need to be able to ovulate. If you're not ovulating, you can't get pregnant yourself. What causes candida? Candida normally lives in the vagina and they don't cause any problem. Sometimes you're taking antibiotics for urine infection or chest infection. Sometimes you're pregnant. Whenever you're taking contraceptive pill, it upsets the environment in the vagina and it makes candida, which is yeast or thrush, become more in quantity and it becomes a nuisance. But candida, same thing as thrush, same thing as yeast infection, can be scanty on a good day in the vagina. It's not a big deal and it does not cause infertility. Can BP drugs cause you not to get pregnant? No. But there's some certain BP drugs that you will be taking that can affect a developing baby. So some medications that you can take for BP, like losartan, for example, they are not good for a woman that is pregnant. So if you're pregnant, you're on such medications, we stop them before you get pregnant, okay? September to testify, yes. What's the success rate of IUI when someone has unexplained infertility? First of all, if you have unexplained infertility, IUI is not for you. Okay? If you have unexplained infertility, IUI, which is intrauterine insemination, is not for you. IUI is only given and used if only the man has the problem, in most cases. Okay? Now, if the woman has problem, we need IVF. If the man and woman has problem, it's IVF. If you have unexplained infertility, just go for IVF. I know IUI is cheaper, but it doesn't mean that it will answer your problem. Don't, because something is cheap, go and do it because you think it's cheap. You're just wasting your money. By the time you realize it, you've spent money for IVF already. So go for the right thing and don't let people lie to you. You're pregnant, you want coffee, babu, no. Can follicles increase from day 8 if you're on FSH before day 11 of IVF? It can. True. It can. Very true. Thank you so much. On Instagram, we have Liz Queen. Thank you, Liz Queen, for moderating here on Instagram for us. Thank you, Liz Queen. God bless you. What's the possibility of getting pregnant with twins? Chance and also IVF. Doctor, is gender selection possible during IVF? From Francisca Aguuche. Yes. Family balancing. Rosemary Igodaro Joaquim, go to a better location, please. Sugar. She needs our address. Can somebody help me give Sugar our ATG address? Okay. Doctor. Oh God, it's so fast. Guys, slow down. No coffee. You try to get pregnant, no coffee. No coffee, babu, no coffee. Okay? Doc, pity me now. Now, what's your question now? Aside from epidural, are there any other means of relieving pain in labor? We have Entonox. Okay, we have Entonox. We have local anesthesia, if that is appropriate for you. Okay, Entonox, local anesthesia. We have spinal, if we do that in theater, yes. And we have epidural as well, as you know. I also have some simple oral anesthesia. In our best, what's your question? Saka Bosse Day, fallopian tubes to be swollen up. If your tubes are swollen and they are blocked, you need IVF. Progesterone 1.2 is too low. Progesterone 1.2, prolactin is very high. You need to get treatment to bring your prolactin down so that you can start to ovulate. We don't have office in UK, but I can advise you you can subscribe and I can go through your results in UK and advise you, but we don't have any office in UK. Okay, I'm in UK though, but we don't have any office in UK. Our offices are in Nigeria. Okay. What causes ovarian cyst? Oluwakemi, we don't know. Nobody knows what causes ovarian cyst. Honestly, I don't know. Okay, I don't know what causes ovarian cyst in a woman, on a woman's ovary. I don't know. Okay, so guys, thank you again for coming today. I really appreciate you. I need to go now, and I'll see you again tomorrow by God's grace. Okay, God bless you. Have a wonderful day and have a wonderful week. Okay, and have a wonderful weekend in advance. This month is a month to be. September. It's going to happen by the grace of God. All things being equal. See you soon. Love you. Bye bye.